Hi Fox, welcome to my YouTube channel. So in this video, we will go over another entity of the interstitial lung disease, which is the organizing pneumonia. So before we go further about the discussion on the organizing pneumonia, let's revise our algorithm how to approach the chronic interstitial pneumonias. Once we have a lesion under the microscope, first thing we have to determine whether the lesion is present in a diffuse manner versus it is present in a patchy manner. If the lesion is present in a patchy manner, we have our top three differentials. One is the UIP, which we already discussed. Second is the COP, which is the cryptogenic organizing pneumonia. Even the cryptogenic organizing pneumonia is the clinical term. It simply implies when the cause of the organizing pneumonia is idiopathic or it is not known. So basically, it is used by the clinical team rather than by the pathologist. And the third differential is the RBILG. Once we have a patchy lesion, then we have to look for temporal homogeneity versus the heterogeneity. Homogeneity by means the lesion is evolving in the same stage. Heterogeneity means the lesion is present in the different edges of the lesion. If the lesion is present in the homogeneous manner, then our two differential remains are the COP or the RBILD. If the airways spaces are filled with the fibromyxoid type of the tissue, most likely we are dealing with the organizing pneumonia. If the air spaces are mostly filled with the pigmented type of the macrophages, then most likely we are dealing with the RBILD. So in this video, we will discuss further about the organizing pneumonia. So starting from the definition of the organizing pneumonia, it is the interstitial pneumonia which is characterized by the polypoid fibroblastic aggregation which plugs the alveolar sacs, ducts or the bronchioles. So here the hallmark of the organizing pneumonia is that when the fibroblastic aggregation or the fibroblastic plugs when they comes into the alveolar sacs, ducts are inside the bronchioles, which are also known as the Mason's body. When we will go over the microscope, this definition will be much more clear. And the organizing pneumonia is one of the most common form of the lung lesion, which is associated with the variety of the diseases, which ranges from infections to the malignancies to the autoimmune diseases, drug reactions, aspirated reactions as well. We will go further over on this thing on when we will discuss about the etiology. Well, in terms of the epidemiology, the median age of the onset is around 50 to 60 years old. There is no sex predominance, and the etiology, there is a no clear association with the smoking history, and the organizing pneumonia can be a complication or the lung manifestation of any other disease as well. When the cause of the organizing pneumonia is not known or it is the idiopathic, then the clinical team uses the term which is the cryptogenic organizing pneumonia. But in our report, we are not obligated to put the term cryptogenic organizing pneumonia. While other etiology factors includes infections such as bacteria, fungi, viruses, autoimmune diseases, aspiration, and drug reactions, and multiple other lesions as well can cause the organizing pneumonia. While in terms of the pathophysiology, organizing pneumonia basically is a repair type of the process in which is response to any type of the alveolar injury. So in the initial step, what happened where there is an injury to the capillary endothelial cells or the alveolar epithelial cells, when there is an injury, they becomes more leaky. As a result, there will be the leakage of the plasma proteins, especially the coagulation factors. Once the coagulation factors or the proteins comes inside the alveoli, they generate the fibrin clotting factors. And further, in the last step, there will be the recruitment of the fibroblast and the myofibroblast into that damaged area, which will generate a loose fibrosis in the form of small polyps, which are also known as the Mason's body. When we will discuss about the microscopic feature, we will discuss further about this small polyps. While in terms of clinical features, these lesions are commonly mild and slowly progressive. patient can present with non-specific sign and symptoms of dry cough, dyspnea, malaise, fatigue, and fever, and the duration of the symptoms can last more than 3 months as well. While in the radiology description, the typical pattern is that there will be the patchy ground glass opacity, some consolidations with or without air bronchograms. The lesion can be unilateral, often it can be bilateral, asymmetrical, and it can be in the central areas versus the peripheral areas as well. And sometimes the most important thing on the radiology that is that it can mimic with the eosinophilic pneumonias, pulmonary lymphomas, and the lipidic adenocarcinomas as well. So this picture highlights one of the patient of the organizing pneumonia. Here we can see that there is a irregular type of the consolidations, and there is a, variable amount, variable sizes of the ground glass opacities as well. So basically, there are non-specific patterns on the HRCT or even on the regular X-rays. While in terms of the microscopic features, which are very diagnostic for the organizing pneumonias, so the hallmark is the fibroblastic plugs. So here we have to be careful when we say fibroblastic plugs versus the fibroblastic foci. Well, we already discussed that the fibroblastic foci are commonly seen in the UIP with UIP, and these fibroblastic foci are parallel to the alveolar ducts or alveolar walls, while the fibroblastic plugs are present inside the alveolar sacs or inside the alveolar ducts. And they are composed of the spindle type of the fibroblast, and they have the pale staining matrix or the mucosaccharide type of the background. And these small polypoid lesions are known as the Mason's bodies. Sometimes these organizing pneumonias can extend, or like these Mason bodies can extend from one alveoli to another alveoli through the help of the interalveolar fenestrate, which this is known as the butterfly pattern. Another variant of the organizing pneumonia is the sequestratial form of the organizing pneumonia, in which whenever we have a Mason bodies, whenever we see halonized or the collagenized form of our Mason bodies have some collagen or hyalinization inside those granulation tissues. This is known as the sequestratial form of the cryptogenic organizing pneumonia. So the importance of the sequestratial lies in terms of the prognosis. Overall, organizing pneumonias have the better prognosis, but once we have a sequestratial form of the organizing pneumonia, then it is carries relatively bad prognosis compared to the secondary or the cryptogenic type of the organizing pneumonias. So this is a low power of one of the microscopic of the organizing pneumonia. So on this low power, we can completely see that the lesion is present in a patchy form, and it is localized in one area, while the background most likely appears that there is a preservation of the lung architecture. If we go on the medium power, we can see that the lesion is present in one area, while the surrounding area have the preserved alveolar architecture. And here we can also see that the alveolar sacs are filled with some fibromixed type of the material, while the alveolar septa are mildly thick as well. If we go on the high power, then this picture becomes much more clear that the alveolar sacs are completely filled with these polypoid type of the lesions, which has the mucosaccharide type of the background. This is known as the Mason's body, which is the hallmark of the organizing pneumonia. While while as we said, we have to make a distinction with the fibroblastic foci, which are present in the UIP. They are not present inside the alveolar ducts. They are present to parallel to the alveolar ducts or the alveolar sacs, and then they are known as the fibroblastic foci. And as we discuss about the sequestratial form of the organizing pneumonia, so whenever these granulation tissues harbor these laminar or eosinophilic or like a hyalinized type of the hyalinization inside these mesons body, this form is known as the sequestratial form of the organizing pneumonia. While discussing about the treatment, overall they have the good prognosis and the completely recovery is with the oral corticosteroids, and overall they have the good prognosis, but they can frequently relapse in 20 to 58%. They it has been seen that they have the relapse as well, and they rarely progress to the severe respiratory failure or can lead to the death. And as we discuss about the sequestratial form of the cryptogenic organizing pneumonia, is more progressive, persistent, and is resistant to the treatment as well. So it is important to put into the sample report as well. So this is the end of my video. Thank you so much.